will soon see a pay raise. That's because of an executive order from Governor Tony Evers.
Ellie La Liberté breaks down where the money is coming from and what it'll do.
The money from this order is an effort to help attract and retain caregivers by raising wages.
Funding is not kind of caught up with what the cost of care is and what the wages are in Wisconsin.
$258 million. That's how much the executive order is directing the State Department of Health Services to spend on 3 different Medicaid programs, including family care partnership, and all-inclusive care for the elderly.
So what this does is provides a significant infusion of funding into the family care program, which is essentially the Medicaid waiver program for assisted living facilities in Wisconsin.
DHS estimates that the money will give a 15% increase to home care services and a 40% increase to services provided at a residential facility.
This will allow us to provide higher wages to our caregivers, our nurses, our executive directors, and also kind of keep in line with inflation and all the rising costs that are going along with that.
Mike Pahowski is the CEO and president of the Wisconsin Assisted Living Association, an organization that represents 1,600 assisted living facilities.
It's a relief, but it's much needed because providers all across Wisconsin, they're struggling right now.
The money is coming from the Wisconsin DHS's allocation of American Rescue Plan Act funds. Kirsten Johnson, the state DHS secretary, chimed in on the order, saying, quote, "This is the right thing to do for Wisconsin's long-term care systems and the providers who care for our state's most vulnerable." The governor also noted a need for continued support, saying, quote, "It's going to be critical for these investments to continue into our next biennial budget so we can address chronic challenges." And Pahowski agrees.
And it's much needed, but it's not where it needs to be at this point.
The order will go into effect on October 1st.